whether it's simply coordination of learned activities or whether it's simply maintaining posture, the cerebellum is very important. What's a drug that impairs cerebellar function?
Weed.
I'm thinking of something more common, even alcohol. Yeah, alcohol.
Oh yes, what I don't do.
So,
Weed's pretty common.
when the police then suspects that you may be drinking, because you're weaving perhaps, or you're dancing like that, so he thinks you may be impaired.
Shots fired.
Okay, what he's going to do is try to have you walk the straight line.
If I'm impaired.
It's called a tandem gait. He's going to have you walk heel to toe like this.
I can't do that sober.
Now, in the absence of proper cerebellar function, what happens? You start to fall to the side. Okay? Another example of
Bridesmaid.
cerebellar function is to maintain an upright posture with your hands by your side, your feet together. Now, most of us, if our eyes are open, we have visual cues, so we can do it. If you close your eyes, you're entirely dependent upon proprioceptive input. And so sometimes people, if they close their eyes, they can't maintain that posture if they have cerebellar dysfunction. Okay, that's called an abnormal Romberg test, where you kind of sway to the side without those visual cues. Another test of cerebellar function would be finger to nose testing, where I say, okay, take your index finger, touch your nose, now touch my finger. Back and forth quickly, tip to tip. And I'll move my hand a little bit. Okay?
Yeah.
Now, someone who has cerebellar dysfunction, hold your finger out. No, hold your finger out. Have you been drinking? All right.
Sorry.
They'll do this. They'll do, and they'll pass point, or they'll start to weave as they're getting close. That's called dysdiakinesis. Okay, so they'll have
actually what I do in
difficulty
my
with
spare
that
time.
rapidly, or they'll have difficulty with rapidly alternating movements like this, or like this. Okay, because that all depends upon proper cerebellar function.
Why do some cops tell you to do the alphabet backwards?
They don't. That's illegal.
It is?
Mm-hmm.
One of my friends said that happened.
I'm not sure if that's a true test of cerebellar
No,
function.
because the cops came to school and we asked them.
It might be.
Really?
Mm-hmm.
It's not all cops do what they
In case anyone's wondering, when I was in college, we had like a lawyer come talk to us about if we ever got in trouble or something like that. And he told us to always politely decline to do an alcohol test.
And
It's an
I
automatic,
thought,
you're
I mean, they're
suspicious.
gonna arrest you if
Right.
you decline to do it.
So you
but
mean
it's
you
easier to
should
help
decline
yourself.
performing any of the physical maneuvers or blowing into the, or both?
What?
He means refuse to do
Yeah,
the.
refuse.
Everything,
Yeah.
okay.
And then they're gonna
Polite.
arrest you, and then it's
They'll
very
suspend your
important
license?
to get in the back of the car and like don't speak and don't do anything, because
Right.
a lot of people will start talking
And they're the worst enemy.
yeah, and they record it.
why did they come tell y'all this?
Oh,
Just to-
because I was in sorority.
Because you're what?
I
In
was in a
sorority.
sorority, and like
Uh-huh,
one of the
right.
girls was working at a law firm, and they just came to
Oh.
talk to us.
I thought you were about to be like, just in case anyone was wondering, I got arrested once.
Well, you know, people get arrested sometimes.
I know. I just.
Oh, no problem.
I thought it. I was like. I was
Dr.
like.
Fenner, have you ever been arrested?
Have I ever been arrested? No, but I have.
Every day.
I've been involved. I used to work in a prison. Did I tell you all that?
Yeah.
Yes.
Okay. So I saw a lot of people
A few
who, in
times.
fact, were arrested, and I would participate in their kind of
Arrest.
input. You know, they would have to all undergo a test and a cavity search and all this business.
I
so-
thought I was gonna get in trouble with the police officers once.
All right, so let's look here. Here's the cerebellum.
I was
As a, these little folds on the surface of the cerebellum are not called gyri, they're called folia. They're like little pleats. The surface appearance is different from that of the cerebral cortex that lines the hemispheres. Okay, so these are called folia. This is the arbor vitae. Again, here's the fourth ventricle that separates the cerebellum from the brainstem. In this picture here, you can see that cerebral aqueduct that's carrying fluid from the third ventricle to the fourth. And you can also see the channel into the central canal of the spinal cord. Okay, so we mentioned that the cerebellum is important with respect to proprioception. And it provides a definition here on this slide: a sense or perception at the subconscious level of the movements and position of the body, especially the limbs that are independent of vision. Damage to the cerebellum causes ataxia. So if you can't walk the straight line, that would be called gait ataxia. Okay? It's an inability to coordinate muscular activity during voluntary movement. Okay? Ataxia can involve simple movements like finger to nose testing, like we depicted.
Not very well.
So you could call that cerebellar ataxia. Now finally, we'll talk about the last component, which is the brainstem. Okay, it's divided into the midbrain, pons, and the medulla oblongata. One of the things that the brainstem is responsible for is housing the cranial nerve nuclei. Okay, so this is the cortex here. Here's the midbrain, here's the pons, here's the medulla, here's the foramen magnum. Let's say this is the fourth cranial nerve nucleus here. This is a collection of nerve cell bodies. It's going to be housed within the pons. These nerve cell bodies give rise to axons that are surrounded by a connective tissue sheath and become known as the fourth cranial nerve, or the trochlear nerve. Okay? So the nucleus, the cranial nerve nucleus, is located within the brainstem. In fact, all cranial nerve nuclei are located within the brainstem, either the midbrain, the pons, or the medulla. In fact, I'm going to show you something else here. This isn't 100% true, but it's a very good way of thinking about the cranial nerve nuclei, that the first four are housed within the midbrain, cranial nerves 1 through 4. Cranial nerves 5 through 8 are housed within the pons, and 9 through 12 within the medulla oblongata. Okay. It's not 100% accurate, but it's good enough for military purposes. I don't know why I said that.
Because you could, that's why.
Yeah, I can say whatever I want. Okay. The brainstem also houses the centers for brainstem reflexes. I think I may have mentioned before that in the setting of ischemia or global hypoxia, typically the last area to go in terms of the central nervous system is the brainstem. So if you want to assess someone for brain death, the neurologist will come in and he'll check for brainstem reflexes. And if they're still intact, then the patient's not brain dead. But once you lose those brainstem reflexes, then you're considered brain dead. Examples of brainstem reflexes, and when we say brainstem reflexes, we're talking about circuits. All reflexes have a sensory limb and a motor limb that create an arc entirely independent of the cerebral cortex. So these brainstem centers are located within either the pons, the midbrain, or the medulla. An example of a brainstem reflex would be the pupillary light reflex, where you shine a light to someone's eyes and both eyes constrict. So if you shine a light to the right eye, both eyes are going to constrict. Or the corneal reflex, where you might take a cotton swab and touch the cornea, both eyes are going to blink. Okay. The brainstem houses nuclei involved in vital functions. Vital means they're necessary for life. So, for instance, the cardiovascular and respiratory centers are located within the brainstem. These centers control heartbeat, control blood pressure, control ventilation. And finally, the brainstem serves as a conduit or passageway for those tracts that are moving up and down the spinal cord, ascending and descending tracts. In yellow here are the cranial nerves. You can see they're all attached in some way to the brainstem. By the way, if you look at the medulla here, these prominences along the ventral surface, these are called medullary pyramids. They're called medullary pyramids because they house the pyramidal tracts that are traveling down toward the spinal cord. This is a nice slide of the pyramidal tracts descending from the primary motor cortex. Okay? For instance, you see that the right primary motor cortex, these pyramidal cells give rise to axons which make up the pyramidal tract. The pyramidal tract descends down first the internal capsule, then down into the brainstem. This is the midbrain. Here in the medulla, the tracts on each side cross over. This is called the decussation of the pyramids. The decussation means the crossover. So tracts from one side cross over to the contralateral side. Here within the spinal cord, we see that the tracts run down these lateral white columns. So they reach the appropriate area of the spinal cord and the axon synapse within the anterior great horn. So located within the anterior great horn, you have these somatic motor nuclei, these nerve cell bodies, that in turn give rise to axons that lead via the ventral root, join the spinal nerve, and they're going to be carried off to some muscle. So these axons would be upper motor neurons all the way down to the synapse at the level of the anterior great horn. You have lower motor neurons that travel then toward the skeletal muscle. Again, somatic motor pathways are two neuron pathways, upper and lower. The decussation occurs within the medulla. Midbrain. Okay, the midbrain is the part of the brainstem that connects to the diencephalon and to the hemispheres. If I show you the ventral surface of the brain here, this would be the medulla, here's the pons, and up higher would be the midbrain. In fact, I'm going to get a brainstem from which the hemispheres have been removed.
Where does he store all of these things? Okay. No, his office isn't that big though. I've been in there.
This is a brainstem, and it doesn't look anything like a brain because the hemispheres have been removed. But if you look at it here, you can see the resemblance. This is the pons, here's the pons. This is the midbrain here along its ventral surface. In fact, these two components here, these cords here, are called cerebral peduncles. If we look at the dorsal surface, okay, there's 2 of these bodies that project off the roof of the midbrain. There's 2 more on the opposite side, except the opposite side, the roof has been removed. So these 4 bodies that sit along the dorsal aspect of the midbrain are called the corpora quadrigemina. We'll see these when we dissect the sheep brain next class. The upper 2 of these 4 bodies are called the superior colliculi. The lower 2 are called the inferior colliculi. The superior colliculi participate in visual reflexes, allowing us to track moving objects, whereas the inferior colliculi are involved in auditory reflexes, like the startle reflex. You know, like if you have an infant, you make a loud noise, and all of a sudden that infant startles and they turn their eyes toward the, well, that's the inferior colliculi. And the reason I bring up these corpora quadrigemina is that when you dissect the brain, you'll see these. Now, the second component of the brainstem is the pons, and I think most of you know that the word pons means bridge. Hence the adjective pontine. How does it serve as a bridge? Well, here's the pons here, and remember, sitting on top of it, this is going to be the 4th ventricle right away. Sitting on top is going to be the cerebellum. Okay? And the pons serves as a bridge between the right and left cerebellar hemispheres. In other words, it carries tracts from one side to the other, like this. The pons also serves as a bridge between the midbrain and the medulla oblongata. so that it serves as a conduit for ascending and descending tracts that are either headed down toward the spinal cord or up toward the cortex. Now, besides being a bridge, the pons also contains respiratory centers. In fact, the respiratory centers that control ventilation are located both within the pons and the medulla oblongata. Okay. Now finally, the most inferior part of the brainstem is the medulla oblongata. And I said that along the ventral aspect, those prominences, those longitudinal prominences, are called the medullary pyramids. Okay? And they're formed by the pyramidal motor tracts. We can also call pyramidal tracts cortical spinal tracts. In fact, most often we call tracts, we name tracts based upon their origin and destination. So because the pyramidal tracts begin in the cortex and synapses terminate within the spinal cord, we can also call them cortical spinal tracts. What would we call a sensory tract that begins within the spinal cord and synapses within the thalamus? We'd call that a spinothalamic tract.
A spinal what?
Spinothalamic.
Oh, right.
In other words, the name of the tract usually includes its origin and destination.
Like the joints, sort of,
Yeah,
maybe.
kind of like a joint. Joint.
I think so.
All right. We said that with respect to the cortical spinal tracts and the pyramidal tracts, that they cross within the medulla. That area where they cross is called the decussation of the pyramids. It allows one side of the brain that controls the opposite side of the body. Now, we also find nuclei important for vital functions within the medulla. Okay, for instance, the cardiovascular centers that control heart rate and vasoconstriction, or vasodilation, in other words, diameter of blood vessels. They're located within the medulla. Respiratory centers, in addition to being present within the pons, are present within the medulla. And you have other vital centers that control things like vomiting, coughing, and sneezing. They're located within the medulla. Now finally, we're going to talk about the coverings of the brain. We call these meninges. Okay? And there are three